And it's sort of a little bit of a respite for patients a lot of times to know, because let's just tackle some of the big problems that cancer patients go through, particularly when they're going through their therapies. Fatigue is a big issue. What are some of the things you do to cope with fatigue?
There's a couple things, and within integrative medicine, certainly that entails nutritional counseling. So many times, one of the first questions that many individuals ask is, what can I do nutritionally to help support my body? And I think that's one of the most important things. And even from the physician standpoint, the reality is we want individuals to be as healthy as possible. And certainly fatigue is one of the things. If we're not feeling particularly well, we're feeling a little nauseous, we may not eat. Our body then doesn't have the energy to do the things that it needs to do. We're dealing with stress, the stress of not only being diagnosed with the illness, but the stress of doctor's appointments and medicines and treatments. And so many times physiologically there is a stress response that occurs where there's many different chemicals and hormones that get released into our system that increase muscle tension, increase our anxiety, our heart rate, our blood pressure goes up, and just dealing with the stress can cause the fatigue. And then also there's fatigue related to our treatments. Many times our blood counts are impacted, which then, increases our fatigue.
All right. Well, we actually have a caller on hold. Let's give you an opportunity to ask a question to Dr. Gauthie.
Good evening.
Good evening.
I was diagnosed
and congratulations
with
for being our
Hodgkin's
first
lymphoma
caller.
in March of 2007, stage 3B. And it was a very difficult process for me. As you were saying, I was going through the chemotherapy, the ABVD. I had tumors all through my neck, my chest, my abdomen, my groin. And for all the callers who are listening, I just want to state to them, just be intrepid and be optimistic and to be strong. What I do have a question for the doctor is, with my diagnosis, a lot of people don't know what Hodgkin's is. I mean, they know about non-Hodgkin's because it tends to be more people have non-Hodgkin's than Hodgkin's, and sometimes it becomes very tedious for me to explain to people, okay, I have Hodgkin's disease or Hodgkin's lymphoma. I was wondering if you could go into a little details about Hodgkin's, and I also have some side effects with the neuropathy as well, but I'm going to get off the phone and maybe you can somewhat differentiate between non-Hodgkin's and Hodgkin's lymphoma. Thank you.
Thank you very much, and it sounds like you're doing well and feeling strong. Doctor, do you want to tackle that? Or
Boy, I think it sounds like there was an increased amount of distress associated with just the realities of having the numbers of tumors throughout your body. And certainly I am not the expert on the medical aspect of the differences between Hodgkin's and non-Hodgkin's lymphoma, and I do believe that you will have one of the preeminent MDs here to talk about the differences between Hodgkin's and non-Hodgkin's. My expertise is really more in dealing with the emotional, psychological, spiritual aspects of having a cancer diagnosis, and so certainly having that fighting spirit and kind of trying to stay strong, as it sounds like this individual was doing, is one of the most important prognostic factors.
It's absolutely key, and the caller identified a couple of very important things, which is it's not just enough to know that you have lymphoma. And even within the category of Hodgkin lymphoma, there's about 5 different types. But generally, it gets its name from Thomas Hodgkin, who discovered the disease under a microscope years ago. And the way that they're able to diagnose it and differentiate it from non-Hodgkin is by these cells in a microscope called the Reed-Sternberg cells. And so it has a very distinct appearance on the microscope. The good news, hopefully for you and for most people with Hodgkin's, is overall it's a very curable cancer. There's the 5-year survival rate of Hodgkin's lymphoma overall is about 90% or approaching 90%, which is terrific. But it's still not good enough. But compared to non-Hodgkin's, of which there's 75 different types, the overall survival rate there is in the mid-60s. And I think we have another caller, so let's take that call right now here on Battling and Beating Cancer. Good evening. That was a short call. Let's try another one. Do we have anybody else on? Okay, we'll get to that in just a moment. But One of the other things that people with cancer, whether it's from surgery, from the cancer itself, or from the treatments, the experience is pain. And boy, oh boy, when you're in pain, that just takes its toll on you. How do you help patients cope with pain?
Certainly, again, when we are given a diagnosis and we're going through treatment, and for many people there is pain associated with either their cancer, for example, with multiple myeloma, if the myeloma it's in the bone marrow, and so many times the bone structure gets compromised, which then can create significant amounts of pain. And so then what happens is individuals are distressed, the brain then kicks in, and then either they're not breathing properly, or they're breathing in their chest, and they're doing what we call stress breathing, which then causes their muscles to tense up, and so then that exacerbates the pain. So the first thing that we can do is teach them breathing strategies, doing diaphragmatic belly breathing. We also use biofeedback, which allows the patient to receive feedback about when their body is under stress and tense, and then we teach them strategies so that they get the feedback of when they're relaxed, and hopefully that can then translate into and generalize into the rest of their body.
And so do you find not only does it help people get through, but the alternative, what used to be alternative medicine, now integrative medicine, actually helps people survive and beat the disease?
Absolutely. I think that when individuals take an active role and incorporate and integrate these modalities into their care, many times that will help to decrease, because we do have research that has been done that looks at chronic, long-standing stress, that it can compromise the immune system. And right at a time when their system is compromised, not only from the cancer, but also from some of the treatments, one of the things that we can do is actually bolster their system by teaching them some strategies to help initiate the relaxation response, which then gives them a little bit of respite from the stress. And anything we can do to bolster their system can actually hopefully bolster their immune system and help to support them through their treatment.
All right, and let's take another caller. Good evening, you're on the air.
Hi, I was calling because I wanted to find out some information about the two lymphomas that you were talking about. Is it detectable in a regular CBC if you have, like the lymph nodes can swell for various reasons. Can you detect non-Hodgkin's lymphoma or just Hodgkin's lymphoma in a regular blood test, or does that have to be something that your doctor targets?
Well, there's a variety of ways that you could tell, and it's sort of the whole picture. But typically, it's not any one particular type of blood test. Ultimately, the diagnosis of lymphoma is through biopsy of the lymph nodes and the tissues. But things like blood work, like scans, like in my case, x-rays were the first thing, are ways that you can diagnose lymphoma. But ultimately, it's the biopsy.
Absolutely, that is correct, yes.
All right. Well, Doctor, we have just a couple minutes left, and you're terrific, and we thank you so much for joining us. But in just a moment or so, why don't you give some final thoughts to people about integrative medicine and its role for cancer patients?
Well, I think that one of the things that we want to look at is, in 2007, the Institute of Medicine published a report on cancer care for the whole patient, dealing with the psychosocial health needs of cancer patients and families as well. So certainly one of the things that we believe wholeheartedly at Rush University, and one of the reasons that the Integrative Medicine Program was initially developed, was that we want to treat the whole person. Individuals, when they hear that they have any life-threatening or life-limiting illness such as cancer, there is a host of psychological and emotional issues that come up. Loss of control, anxiety, depression, loss of their role in the family. Maybe they were the breadwinner, and now all of a sudden it's impacted their ability to work or to be that breadwinner. So there's a number of issues that can come up. So one of the things that we want to make sure that we're doing is addressing the whole person and giving as many skills and strategies to them as possible to help them in battling their cancer. Everything from acupuncture, massage therapy, biofeedback, medical hypnosis, relaxation, imagery, and in fact, had worked with an individual who was had been told at an outside hospital that their cancer was, so advanced that there was nothing this hospital could do. They came to Rush, and in working collaboratively with medical oncology, radiation oncology, surgery, and then also they were interested in combining an integrative approach, use of medical hypnosis to give them some suggestions, their mind, kind of help work with kind of their mind to manage the distress they were experiencing. The whole package put together, the reality was that this individual now is back to work and really feeling well and has gotten through surgery, radiation, chemotherapy, but took an active role, saw where they had control. You may not always have control of the cancer or the treatments that you have to undergo, but the reality is anything that we can do to help individuals feel like they have an active control over their life, that's where I think the benefit truly comes in.
Absolutely. And Doctor, thank you so much for joining us. And we'll get Charlene back in here for a second, because what we'd like to do is give everybody a heads up about our bike ride on Sunday, September 12th. And Charlene, why don't you talk about that briefly?
Okay, thank you again, Doctor. There's Chicago Blood Cancer Foundation Alfred Blood team will be participating in North Shore Century Bike Ride on September 12th. It's Sunday, and people can ride a mile, 100 miles, or any distance in between. The ride starts at Evanston Township High School, flexible morning start times. Non-riders can participate by forming a virtual vampire team online. Pedal to Cure Lymphoma, Leukemia, and Myeloma. Proceeds benefit lymphoma, leukemia, multiple myeloma research at leading Chicago area medical research hospitals. And next, I want to talk about our next week. Our program will be at Wednesday, 7:30 on Chicago Blood Cancer Foundation, Battling and Beating Cancer. Dr. Leo Gordon, Director of Lymphoma Program at the Robert H. Lurie Comprehensive Cancer Center of Northwestern University, will join us, and we will be discussing lymphoma. Dr. Gordon is fabulous, and you will not want to miss the show. Again, we thank you for joining us here on CAN TV 21, and we also want to thank our producers, directors, Christy, Dorothy, and you can reach us at www.chicagobloodcancer.org, or you can call us if you have any questions at 888-792-9992. And we will see you next week. And I want to thank my husband, my wonderful husband here, who's been my mate for 23 years here.
And we fight the fight on behalf of others who are going through it. And remember, you don't have to fight cancer alone. There are people to help you. There are fine doctors like Dr. Gauthie to help you. And there are organizations like the Chicago Blood Cancer Foundation. Till next Wednesday evening, everybody, take care, good night, and good health.
Thank you.